Hi, my name is Shayna Bates, and I'm a student at Indiana State University in the LPN to BSN program. This presentation will discuss preventing opioid dependence in sickle cell disease population. The purpose of this presentation is to increase the awareness of community resources and support for individuals with chronic illnesses such as sickle cell disease. Individuals affected with sickle cell disease are at risk for opioid dependence. Let's educate this population on non-pharmacological interventions and coping mechanisms to prevent opioid dependence. After this presentation, the learner will be able to utilize communication approaches by relaying concepts to prevent opioid dependence and sickle cell disease. The learner will also be able to conduct a holistic assessment and utilize evidence-based practice to formulate non-pharmacological care plans to reduce the need of opioids. The learning objectives for this presentation is to define sickle cell anemia, identify at least 3 triggers of a pain crisis, state 2 reasons for drug dependence in sickle cell disease, identify at least 3 healthy habits for preventing sickle cell crisis, which decreases the amount of opioid use, identify at least 3 non-pharmacological interventions to treat pain crisis, and explain the importance of holistic assessments, community resources, and support for individuals with chronic illnesses. This picture shows normal red blood cells and sickle cells, which we will discuss soon. Move on, please copy and paste the link below and take a 10-question pretest to identify what you know about sickle cell disease and opioid dependence. Now that you've completed your pretest, let's discuss sickle cell disease. Sickle cell disease is an inherited disorder of the red blood cells that primarily affect African Americans. Sickle cell disease produces red blood cells that are abnormally shaped. Sickle cell disease is inherited by a sickle cell gene from each parent. During hospitalization, routine newborn screenings, sickle cell is often detected, but can also be detected before birth. Diagnosis of sickle cell is completed by a blood test. The difference of sickle cells and normal blood cells are: normal healthy red blood cells are round, flexible, and smooth. They move freely through blood vessels, properly carrying oxygen to all the body parts. Sickle cells differ. They are hard and tend to stick. They appear in the shape of the letter C after losing their oxygen and also die early. Sickle cells traveling through the blood vessels become stuck, which results in clogged blood flow. Red blood cells compared. Here's a picture of normal red blood cells. It's round, flexible, and smooth. Here's the difference of a sickle cell. It's stretched, stiff and breakable, pointy and sticky. As you see here, normal red blood cells flow freely through the blood vessels. Here, the cells are sickle-shaped, and they cause blockage in blood vessels, which results in pain crisis. In order to educate the sickle cell disease population, we must first teach them how to identify their triggers. Examples of sickle cell crisis triggers are dehydration, cold weather, stress, infections, alcohol, diet, major physical exercise, other medical conditions. These all play a factor in a vaso-occlusive pain crisis. Among patients hospitalized with sickle cell disease, there is a correlation between dependence of opioids and complications of sickle cell disease. According to Parim Betty, patients susceptible to vaso-occlusive crisis necessitate frequent use of opioids and become dependent. Opioids can alternatively increase the risk of sickle cell disease complications. There is a higher hospital mortality rate in patients with opioid dependence. Let's discuss reasons for opioid dependence in sickle cell patients. Uneducated on non-pharmacological interventions for pain. Has not developed other coping mechanisms for pain. frequent prescriptions of opioids, lack of support and community resources. Learning healthy habits can prevent overuse or misuse of opioids. Here's a checklist to use as a resource. Sickle cell patients should consume fruits, grains, vegetables, protein, and dairy. Sickle cell patients should also exercise, but avoid overdoing it. This could cause a pain crisis. Sickle cell patients should maintain hydration by consuming at least 8 to 10 glasses of water daily. This assists their blood cells in flowing freely through blood vessels to prevent blockages. Avoid stress. Stress can lead to pain crisis. Sickle cell patients should avoid becoming too hot or too cold, as pain crisis may be the result. By learning and implementing healthy habits, sickle cell patients can reduce the amount of pain crisis, which in return reduces the amount of opioid use. Let's discuss non-pharmacological pain interventions when the use of opioids can be avoided. Use of a heating pad is a comfort measure that can be used to treat sickle cell pain at home. Relaxation, meditation, deep breathing, and music therapy are also examples of non-pharmacological interventions. The purpose of non-pharmacological interventions is to treat pain without the use of pain medication. We want those affected by chronic illnesses to live well at their best potential. It is important to educate the sickle cell population on finding quality medical care, such as a hematologist, attending regular wellness visits to prevent complications, prevent infections by receiving vaccinations, such as the influenza vaccine, unless contraindicated, learn pain triggers, practice healthy habits, utilize community resources. Most importantly, find out what works for you, as every individual with sickle cell is not the same. Nurses should perform holistic assessments that not only assess the physical health of the person, but their mental, emotional, and spiritual health. Holistic assessments provide education, assist in providing education and support needed. Benefits of community resources include financial support, transportation, support groups, education, and chronic disease management. While researching community resources for individuals affected by sickle cell disease, I came across the Community Health Intervention Specialty Clinic that provides a wide range of resources and support for those affected by sickle cell disease. The Community Health Intervention Specialty Clinic provides integrated healthcare services to the citizens of this county with the help of professional, educated personnel such as therapists, physicians, and social workers. They address health-related challenges affecting our community such as sickle cell disease. Please take a minute and complete the post-test. You may copy and paste the link below to take the post-test to see how much you've learned. Please copy and paste the link below for a summary of this presentation. Thank you for listening.